Our lovely 66-year-old patient is 2 weeks out from her abdominoplasty, and she comes in today, and she's very graciously agreed to share some of her thoughts and feelings about how she's doing and what her recovery is like so far.
I feel absolutely wonderful. I am thrilled. I feel like I have the body of a woman that's 20 or 30 years younger than my actual age.
That's awesome.
I just feel so renewed and so excited.
Do you hate me? Because most patients hate me for the first 3 days.
I have to tell you, Dr. Claytor, I love you.
Oh, well,
I think you are the best.
Well, that's very kind.
Absolutely.
But I mean, the first 3 days, you hated me then, didn't you?
I did not hate you.
Sure?
I did not hate you. I hated myself.
No, it's not meant to be that. You were meant to project that to me.
I put it on
absorb
myself. I said to myself the first 3 days, oh my gosh, I'm not so sure about this. But I had so much faith and trust in you, and you were so positive, and you made me feel confidence because you were so confident in this whole procedure that my faith in you got me through that.
I love it.
Yeah, and I just think you're awesome.
Well, you've done extremely well, and you're healing up beautifully, and your belly button looks fabulous, and your scars all have the glue on it at the moment, and as we talked about, you can feel comfortable with the washcloth and sort of pushing on it a little bit harder to sort of scrub it off, if you will.
Okay.
And when I see you again in 2 weeks, we'll be able to start talking about when you start the scar cream for your scars.
Yes, I wanted to ask you about that, elastin.
Yeah, there are all kinds of amazing products that we can use, and we'll talk about it when you come back in 2 weeks.
2 weeks, okay.
But I want to hear from you. Here you are at 2 weeks.
Yes.
What were some of your fears and apprehensions moving into this operation?
Well, I'll tell you, I had 4 other consultations with other plastic surgeons. All of them were requiring drainage tubes.
Yeah.
My husband and I, that was our biggest fear.
Sure.
We didn't think we could deal with that.
Yeah.
When my daughter-in-law, who you performed a procedure for her, she and my son were very happy. And so I went to your website and started reading a lot and spending a lot of time on your website because there's a lot you can learn there.
So true.
And when I realized that you have this drainless procedure, I thought I have to have a consultation. I have to check this out. This is probably the answer for, and it was. It made it so much easier for me to have this surgery. So much better.
I love it.
I don't know if I would have had the surgery if it hadn't been for me finding you and being able to have the surgery without the drainage tubes.
I hear that a lot. And I'm happy to be the one to be able to provide that service. I certainly teach people around the country and have lectured around the world on how to do this without drains. And it's more than just don't use a drain. It's a whole comprehensive package of everything from how the team helps take care of you to how the binder is positioned to the surgical technique to the numbing medication that I use to every tiny little aspect of it all culminates, and then the patient, you get to see it as, it's drainless. Yeah. But it is way more than that. It's way more comprehensive than that. But I'm loving that you're feeling so great about your results.
I am. And I have to tell you, your entire team, I can't tell you, they are beyond, I don't have enough words for you and your entire team. Absolutely.
Who are some of the people that stand out the most?
Oh my gosh, Corinne is absolutely awesome. Yeah.
Debbie's fabulous.
Julie.
Yeah, Julie.
Danny.
Ready. Danny's
Olivia.
Well,
Emily.
You're nailing everybody.
Everybody. And I even spoke to your wife, Sarah, and she was awesome also.
Well, we're married 33 years coming up in a month.
Yes, she told me 33 years.
So she's
going to keep you.
Yes, she can. For another 33 years.
Yes. That's
going to have to play this for her so that she can hear this, but that's awesome. You're too funny.
Well, I told her that my husband came with me for the consultation,
Yeah.
and my husband was so impressed with you. He said to me, Deb, if I were having this surgery, that's the man I would have do my surgery.
I love it.
And I told your wife that, and she said, oh my, she said, that is such a wonderful thing.
Yeah.
She said, do you mind if I tell my husband that? And I said, no, if he hasn't already heard it, you go right ahead and tell him.
I love it. You're
Yeah.
so great.
Yes.
You're so wonderful. Well, we do have a lot of husband and wife team who do their journeys together with us.
Mm-hmm.
So when he's ready.
Yes.
But
Yeah.
it's been a wonderful experience taking care of you, and we're still on this journey together. You're 2 weeks into it.
Yes.
And we're going to let you forego the abdominal binder and switch into your Marina body garment now.
Okay.
And you're done all your shots, right? Oh, we got another 2 weeks?
I wanted to ask you
Oh,
about that.
how many weeks do we have it for a month?
I have a supply for a whole month. I've done
Okay.
two weeks now,
Okay.
and I wanted to ask
What
you
was
if
your
I
reason
must
again?
continue.
What was your history?
The history is my mother had a knee replacement,
Yeah.
and when she had the knee replacement, she had a deep vein thrombosis,
Right.
but hasn't had any problems since.
Right. So she's marginally increased in her risk factors, which then that flows down to you to having marginally increased risk in your factors. And you're done the leg squeezy bobs. You wore
No,
those.
I
You
still
still
wear
got them
I
on?
still wear them all the time.
How about we do this? How about because you have about a 2-hour drive to get here?
Yes.
Yeah. When you're home ambulating at 2 weeks now, you can stop using the Lovenox. But when you get in the car to drive down here next time, give yourself a shot before you get in the car.
Okay.
Okay?
Yeah, that's fair.
That's
that
fair.
sounds great.
I love it.
That's fantastic.
Yes. Well, it's all about customizing your results.
Okay.
My last question for you is something that I ask everybody.
Mm-hmm.
Is this something that you would recommend to a friend?
Absolutely, without a doubt. I'm telling you, I would. If I had a friend that was feeling very uncomfortable about her appearance and her self-esteem wasn't good because of all this loose skin,
Yeah.
I would, without a doubt, recommend you and encourage her to have this surgery.
I love it.
Because I feel fabulous. I am so happy that I had this done.
Well, this is what we strive for every day.
I am. And you're the doctor to do it. Absolutely.
You're very kind.
And I have to tell you, I am considering in the future.
Okay.
I've, mentioned about, possibly my neck at some
Okay.
and I would definitely come back to you.
Well, thank you.
Absolutely.
I look forward to talking to you more about that.
Yeah. Hopefully someday.
All right.
Yeah.
Well, I will see you back in 2 weeks. You have my information. You send me a picture or a question if anything isn't going perfectly.
That website.
But I will see you back in 2 weeks.
Okay, that's wonderful.
Thank
I look
you.
forward to seeing you and the rest of the staff.
And the rest of the team.
Absolutely. Thank you.
You're so welcome. Bye.
Bye.